When we thought about social innovation in the government perspective, we actually thought about what was the role of government first. We are a large funder. Well, probably the largest funder of the government was the largest funder of social services more broadly. Second, it's got convening power. So from our office's perspective, we approach social innovation in probably four large buckets. One, finance mechanisms. Two, how to bring new ideas to the table. The third, data and technology. And the fourth, people. We were thinking about how can we use finance differently to look at what's happening in communities, what's working, and then how can the government be thinking about this and from a scale perspective. Government's probably not the best at just funding innovation and thinking about innovation, but what we're good at is trying to say what's working in different places and how can we apply it more broadly. We measure success by the number of people served. Everybody's asked to look at metrics, and in many ways from a congressional side, you're asked to make sure that the money got spent properly. And spending the money properly, you follow the money trails and you follow how many people got served, what did we do, but we don't actually look at the one question that probably government should think about is what's the outcome we're trying to achieve. We don't actually look at what exactly it is we're trying to do in poverty or what agencies look at that, but more broadly when we think about it from where I was sitting at the White House, we had to be able to ask those questions and to be able to think about that. And then how do we give the flexibility to agencies to test these ideas that they may want to try differently? The first place where we started was creating a fund called the Social Innovation Fund. The idea of creating the Social Innovation Fund was to say we could give scale capital to organizations that had achieved some success. But we didn't want the government to define how the money got used as much as they had to have scale of impact, and they had to use rigorous evaluation techniques. And even there, we didn't define exactly which technique, but rigorous evaluation was the broadest. So we would get data in as to what was working, and then to think about how do you reform and redefine these definitions over time. What we found is not many agencies were doing rigorous evaluation anyway. We don't want this just to be an agency's doing something, but we needed to step back and say, what are we learning from those agencies and what they're doing? Cities and states are trying a variety of different things. It would be great to capture what's happening and then understanding if some city comes and says, what should I do? It would be great to understand what factors worked in city X versus what factors might work in city Y. Right now, everybody's just going around saying, well, we're doing this here, so you should do the exact same thing. Well, situational contexts matter a lot. Data is an important aspect of this. How do we look at data differently? And how we look at data cross-sectorally is something that would help a lot. We all talk about collaboration, but we don't actually do collaboration. Technology makes collaboration easier. International perspective on this is where a lot of the change is actually happening, because they don't have the constraints of changing systems, they're just building systems in healthcare and education. There's probably some good lessons learned on what's happening internationally that we might think about bringing domestically. The experts know what they know, but we don't always know what we don't know. And bringing people who might bring that other thinking to the table is a great point.